But I still, I'll still have a little bit of the lingering cumulative, just to keep things in that broad perspective. But no doubt about it, across the country, the state, the county, here in Visalia, we definitely are seeing a rising trend in both the positivity rate, that is the number of people that are tested that test positive, as well as the hospitalization rate over the last 14 days. Both those important measures, we are continuing to see them rise. The state right now is reporting that over this most recent 14-day period, that the positivity rate that we're experiencing across the entire state is 7.4%. And that varies significantly from county to county, and I'll touch on Tulare County in a moment. There have been 6.7 million tests that have been conducted now statewide. You've heard, significantly greater testing is occurring, and that's good. The state is now averaging about 130,000 tests per day across the entire state. Again, varies significantly from county to county, depending on the resources they have, the testing capability, and so forth. Of those 6.7 million tests, 414,000 have tested positive since inception. So we now are averaging, again, let's say over the last 7 days, we're averaging just over 9,400 positive cases every day statewide. A week ago, that was 8,300 tests per day, positive tests per day in that over that 7-day period. So definitely, we're seeing more positive cases, but that is expected because we're doing more testing. So you definitely hear a lot of people are saying, well, the reason we have so many more positive cases is because we're doing so much more testing, and that is true. But at the same time, when the positivity rate increases, that also means that while we're doing more testing, a higher and higher percentage of people are testing positive. So it's a combination of more tests plus a rise in the positivity rate. Of those 414,000 people that have tested positive for the virus, 7,900 have died, which is translating into about 3.3 deaths per 100,000 population. So that's essentially the California statewide COVID-19 related death rate, 3.3%. Here in California. So here's, I want to share some information that came off the state's website. And again, I'm going to give you an age breakdown, and I'll first say the number, or I'll say the percentage. So remember, there's 414,000 positive cases in California and roughly 7,800 deaths. So I'm going to go age by age and tell you the percentage in that age category that have tested positive for the virus and the percentage of deaths, total deaths, that are associated with that age category. So I'll move rather quickly here. So 1.9% of children under the age of 5 have tested positive. None of them have died. Between the ages of 5 and 17, 6.8% have tested positive. None of them have died. 18 to 34-year-olds, 35.2% have tested positive. It's the single highest age category in California for those that have tested positive for the virus. So 35.2%, but only 1.2% of the deaths are attributable to that age category. 35 to 49 years old, 25.1% of the positive tests, but only 5.4% of the deaths. 50 to 59, 14.2% of the positive cases, 9.7% of the deaths. So now you're going to see the percentage of total deaths, the percentage of those 7,800 deaths that are in these age categories that are now getting older. 60 to 64-year-olds, 5.2% testing of the positive tests, but 7.4% of the deaths. 65 to 69 years old account for 3.6% of the positive cases, but 9.6% of the deaths. 70 to 74 years old only account for 2.5% of the positive cases, but 11% of the deaths. And then lastly, 80 plus years old. Only 3.6% of the positive cases of the 414,000 cases, but they account for 44% of the deaths. So of the 7,800 deaths, 3,400 or 44% roughly are over the age of 80. So this is really what we have been seeing, is that we have this very young population that accounts for the highest percentage of those that are contracting the virus. In fact, roughly 70% of them are less than 50 years old that have contracted the virus, but they account for a very low percentage of the deaths. Right. The highest percentage of the deaths are definitely in the elderly population. Mm-hmm. And that's our fear, is that, or our concern, is that the elderly population is hunkering down. They know that they're the most vulnerable, the most at risk, and so they're trying to shelter in place. They're trying to really limit their interaction with other folks. But it's that younger population that is at lower risk of dying, but is at high risk of contracting the virus, and unfortunately then exposing elderly folks to the virus. Mm-hmm. So that's what we're seeing at a statewide level.
Can I ask a question?
Yeah,
okay,
sure.
So how many were immune compromised prior to contracting COVID? Do we have stats on that?
Yeah, we do. I actually shared those. This was probably many sessions ago. But we found that in every one of the deaths that we experienced here at Kaweah Delta, every single one of those patients had at least one underlying comorbidity. Diabetes, obesity, congestive heart failure, COPD, asthma, renal disease. Every one of those patients had one of those underlying comorbidities. I mentioned that we will, in fact, I just had a meeting a couple days ago. A group of us met to kind of really rethink what we're putting out there on our dashboard. And one of the things that we want to add to it are, we're going to add deaths, we're going to add the number of deaths, the age distribution of the deaths, and the underlying comorbidities that are prevalent. Because I want folks that are out there, we have one of the highest diabetes populations in the United States. We use more insulin per capita in Tulare County than anywhere else in the U.S. So high percentage of diabetes, and it seems to be one of the leading underlying comorbidities of those that are being hospitalized and dying of COVID. So I do want people with diabetes to be extra cautious. Right. Those folks that are obese or have any of those other underlying comorbidities, certainly the science and the statistics are showing that they're at greater risk, and so they need to be extra cautious. So I'll jump ahead. So a question I have never been answered in the past, again, but this is something we'll start showing on our dashboard. We have 81 positive COVID patients in-house right now, or this was as of 10:33 this morning. That's the highest number of COVID positive patients we've had in the acute medical center since the inception of the pandemic. A few days ago, we hit 81 as well, but then it's been hovering in the high 70s, right around 80. So let me tell you the ages of those 81 people that are in the hospital right now. None of them are younger than age 5. We have one that is between 5 and 17. We have 5 patients that are between the ages of 18 and 34. We have 20 patients between the age of 35 and 49. That's the highest cohort of all 81, is in that age 35 to 49, which I think is a trend that we are seeing. We are seeing more younger people hospitalized, but that also could correlate to we're seeing a higher and higher percentage of young people contracting the virus because they tend to be more active socially, and putting themselves in greater exposure conditions. So 20 of the 35 to 49-year-old. We have 7 that are 50 to 59 years old. We have 7 that are 60 to 64 years old. We have 13 that are 65 to 69 years old. We have 18 that are 70 to 74 years old, 4 that are between 75 and 79, and 6 that are 80 years or above. So interesting, we have current hospitalized COVID patients that really cut across the entire age continuum.
Yeah.
But again, only one that is under 17 years old, which is generally what we've been seeing nationally, is people that are of younger age. They are less likely to contract the virus and much, much less likely to be hospitalized or die of the virus, which I know makes the whole issue about opening schools or not even that more, frustrating, difficult, challenging.
Right.
So we'll see.
Right.
So that's some new information. Hopefully you found that valuable. Again, at the state level, there are 58 counties in the state. 33 of them are on the state's watch list. And as such, that's what triggered the governor's action back on, I think it was July 18th, where all of our, or many of our businesses had to ramp up. Might have been actually sooner than July 18th. That seems too recent. But we're no longer in-room dining at restaurants, closing
Monday.
salons,
Right. Yeah.
barber shops. Unfortunately, we had to close the Lifestyle Center again. So Tulare County was not unique in that. We were one of 33 counties that were forced by the governor to ramp back. There are currently statewide 8,820 COVID positive patients that are hospitalized, and roughly 2,300 of them are in ICUs. And there have been just over 20,000 healthcare workers that have contracted the virus, of which 111 have died. So that's where we are at the state level. At the county level, and I'll give you this website address for any of you that want to kind of search around. And the county has added additional information. I was on it this morning, and I see that the positivity rate has now been added back to the graphs that the county is displaying. So that website is covid19.tularecounty.ca.gov. If you go onto that website, you'll see a graphical display, and if you click on positive test rate graph, that will take you down inside of it, and you can literally see the 7-day positivity rate over this entire period of time. So the county, we performed 6.7 million tests at the state level. We performed just under 62,000 tests at the county level. We were, just last month, we were doing about 986 tests per day. We're now up to almost 1,200 tests per day. So that's a 19% increase from last month to what we've done through the first part of July. Of those almost 62,000 tests, 7,900 of them have tested positive. So again, that's from inception. 4,332 of them have recovered. We've had 168 deaths countywide, and there currently are 381 COVID positive individuals that are under quarantine. Across Tulare County, there are 93 patients that are currently hospitalized, 81 of them here at Kaweah Delta, and then I don't know how accurate the 93, because I do believe Sierra View Hospital is pretty much the only other hospital that has COVID positive patients, and they've been experiencing a tremendous surge in hospitalization and COVID positive patients. They've had to transfer a number of their patients to the Porterville Development Center which is one of the alternative care sites. It has about 20 patients, and they are taking COVID positive patients there. But the Sierra View Hospital actually contacted us earlier this week asking if we'd be able to accept any of their patients to transfer to us, which unfortunately we were not able to do it. So it could be that the county's information might be trailing a bit on hospitalizations. On July 11th, which is the last recorded date for the county's positivity rate, they report a 7-day trailing positivity rate, and they're reporting right now Tulare County is at 12.1% compared to the statewide average of 7.4. I kind of looked back over the recent weeks and month. So again, 12.1% was the 7-day trailing on July 11th. On June 27th, just a few weeks ago, it was 7.9%. So, and then if you go back to, so June 27th, it was at 7.9, which is interesting. On June 5th, it was at 13.8. So June 5th was one of the highest that the county had experienced at 13.8, but then we saw that dip down just before the 4th of July holiday to 7.9, and now a week after the holiday, it's now up to 12.1%. Tulare County still ranks third out of the 58 counties in the state in terms of deaths per 100,000, and still ranks fifth in terms of the total number of positive cases per 100,000. In terms of Kaweah Delta, I mentioned we have 81 COVID positive patients right now that are in the hospital. 37 of them are in critical care between the ICU and the intermediate critical care unit, and 13 of them are on ventilators. Kaweah Delta's positivity rate, because we collect a vast amount of the specimens that are collected countywide, and we have the capability of doing our own testing. But we're going to always be higher probably than the county, because for the most part we only test symptomatic patients. The only real asymptomatic patients that we test are those that are going to have an elective surgery or procedure. We test all of those patients prior to their surgery, generally within 48, 72 hours. And if they're symptomatic, we cancel the case. So we're really testing asymptomatic patients there. But other than them, we really only test symptomatic patients. So our positivity rate over these last 14 days stands at 19%. So the county at 12.1, but we're at 19%. We've had 226 employees that have tested positive since the inception of the pandemic. Fortunately, 143 of them have recovered, many of them back to work. But we do have 81 that are quarantined at home right now, and the vast majority of them are RNs, LVNs, certified nursing assistants, and we have 2 of our employees that are currently hospitalized. I've mentioned in the past we own 96 ventilators, adult ventilators. 54 of them are in use right now, so 13 of them being used by COVID patients, the other being used by non-COVID patients who need help in breathing, which means that we have 42 that are available still, which sounds like a lot, but just in a week we went from having 5 COVID patients on a vent to now 13. So we're feeling pretty good about the 42, but obviously that continues to be a concern. So that's a snapshot. I do want, also the hospital census, which is something that we are going to add to the website as well. So I think that's really, the thing that we want people to really understand carefully is the impact that it's having on their local hospital and our ability to take care of the healthcare needs of our community, whether you have COVID or not. So with 81 COVID positive patients, those might be patients that we would not otherwise be taking care of. If we didn't have this virus out there, if we didn't have that pandemic, we'd still be taking care of all those other, heart attacks and strokes and everything. But now we have many patients that are coming to us with the singular diagnosis of COVID, and often complex pneumonia, complex respiratory conditions that we wouldn't already see. So that's what's really putting the pressure on the hospital. So as of this morning at 7:03, we are running at the medical center a 90% occupancy rate. Now it's important to differentiate between physical beds and staffed beds. So I know that's kind of can be confusing. So when I talk about the 90% occupancy rate, I'm only talking about the actual physical beds. So if we only use beds in the acute medical center for one patient per room, which is what we're trying to do. So the ICU, the medical ICU, has 21 physical beds in it, but 3 of those rooms is double occupancy. So we've closed that to single occupancy. So that means I have 18 physical beds there. Same with the ICCU, which is a 30-bed unit. There's 19 rooms, but 11 of the rooms we can double up, so a census of 30. But I'm only counting 19 beds right now. So if I just count those single occupancy rooms and I exclude maternal child health, which is NICU, mother baby, labor and delivery, the nursery, we do have a few COVID positive patients in those units, but we're not currently considering those beds available as surge beds, for additional COVID positive adults or any type of adults. So I exclude that. So with those adjustments, we have 330 physical beds. Right now, 297 of them are occupied. 81 by COVID positive patients, the rest non-COVID positive. That means I have 33 physical beds that are still open in the medical center that we could admit an adult patient into, COVID or non-COVID. But I don't have staffing to cover those 33 available physical beds. We are essentially at full staffing now. If we didn't have this pandemic, and the meeting that Deb was referencing this morning, our monthly leadership team meeting, Jamie Morales, who is our talent acquisition director, she recruits all of our nurses for us. She said that we currently have 40 open RN positions that we're recruiting that's completely independent of this pandemic, that if we didn't have it, we'd still have that many openings. Now, fortunately, on a very positive note, we have a lot of newly recruited nurses. We've been very successful over this last recruiting session of attracting a lot of new nurses that are going through training right now. They're being onboarded, many more in the pipeline, and that's a very positive thing. But because we have 40 open positions and we have 80 employees that are quarantined right now, that's really impacted our ability to staff. So I can't say with any specificity right now of those 33 physical beds, how many more could be staffed. It's probably a handful at most.
So this is probably a stupid question, but what if you pass that mark of staffed beds? What happens then?
Well, we look for other places to place the patients. We transfer them to the Porterville Development Center. Those that could potentially, there's really no other hospital to transfer them to. Community Regional Medical Center is full.
It's overwhelmed.
Hanford Community Medical Center is full. Unfortunately, we're operating outside of nurse ratios right now. I mean, normally on a medical surgical unit, a nurse might have 4 patients, at most would have 5, but now it's not uncommon to have a nurse responsible for 6 patients.
Okay.
So it would continue to stretch us. We are pulling a lot of our non-bedside nurses, so nurses that work in case management or clinical education, are part of our clinical documentation team. They're RNs, but they haven't been at the bedside for a while.
Yeah.
We're pulling them in. We're putting them literally a crash course in onboarding back their bedside skills. We're teaching med-surg nurses how to take care of critical care patients, how to take care of a patient that's intubated. One of the things that that the governor has allowed us to do is we literally are taking nursing students at COS that were, say, in their last semester, and we've hired them. They haven't graduated yet from nursing school. They haven't sat for their boards or anything, but we've hired them to serve as sitters. So sitters are quite common when you've got patients that are a fall risk. And so we literally will put a nursing assistant outside the patient's room, and they might be watching 2 or 3 patients at the same time to make certain that that patient doesn't get out of bed. We would normally be putting a certified nursing assistant in that position, but now we can bring in a nursing student and have them there, which then frees up that CNA.
Right.
So we're looking for all avenues. The state does have a voluntary health workforce of physicians and nurses, and Mark Mertz works closely with the state to potentially pull in those reserve clinical staff to help us in the event we need it.
Okay, so question, do we hire traveling nurses?
Absolutely. In fact, I think Jamie reported that we may have as many as 80 nurse travelers. I think we have 40 of them here now and are looking to bring in another 40. But again, they're very scarce because this surge is breaking out nationwide, so they're not as available as they were before. We did bless the U.S. Department of Defense, delivered 13 registered nurses to us last week, 4 physicians, 2 respiratory therapists. They've all been onboarded. General Mike Stone, Major General, was here from the Army. He oversees the deployment throughout California, so he visited us on Sunday morning. It was pretty exciting to meet a general, but we toured him throughout the hospital, took him up on the ICU and 2 south, 3 north, and he got to meet many of his servicemen and women that are by the bedside. At 1 o'clock today, the colonel and lieutenant colonel from Travis Air Force Base, which is where these folks were deployed from, they'll be here because they want to meet all of their young servicemen and women as well. So that's been a big plus too. So I'll just again, so Kaweah Delta Medical Center, these 33 empty beds right now, physical beds. I'll just break it down quickly. 1 empty bed in the ICU, 2 empty beds on 2 South, and PEDS, which is a 12-bed unit, is closed right now. So literally, in terms of normal critical care beds, we only have 3 beds open. So I mentioned we have 44 of, no, excuse me, I'm sorry, 36 of our patients are in critical care right now, either on the ICU or on 3 West. And we only have 1 critical care bed empty right now. People ask, okay, so what would you do in the event of a surge? And I went through it. I mean, we have many other beds. So the 33 I just mentioned. But let's say I double up those 3 rooms in the ICU. I double up those 11 rooms in the ICCU. I now can create 47 physical beds in the acute medical center. Today, I also have 34 empty beds in the acute rehab hospital out on the West Campus. We have 10 empty beds in the short stay skilled nursing unit out on the West Campus. We have 2 empty subacute beds on Court Street, and we have 9 empty transitional care beds or skilled beds on Court Street. So if you include all of those, I mean, and that's where we would surge to. If we had to, we actually have 102 additional physical beds that are currently empty. So I would, Randy Groom sent me an email this morning and said, Gary, I'm still holding the convention center for you. Do we need to start talking about it? I would first look to those 102 beds. But again, I don't have the staff right now. So that's the greatest concern, and that's the concern of every hospital in the Valley right now, is we simply don't have the staff.
Right. Okay. All right, so that covers a couple of questions that you have submitted.